All right, welcome everybody. Today I have my friend and client, Lisa. Lisa is a physical therapy assistant, but she also became a one-on-one client. She just went through my 4-month-long posture transformation program, and I wanted to bring her on to talk about her experience within the program and also how this process differs a little bit from physical therapy, because I think she's a good person to talk about that with. And she's just awesome, and we're going to have a great conversation today. So, hi, Lisa. Welcome to my chat. I don't know.
Thanks for having me.
Yeah,
It's fun working with you. So this feels like we're just doing our weekly meeting.
Exactly. Yeah, we're just having a little chat.
I don't have to tuck in my shirt and I can cover my sleeve.
I know, you don't have to wear shorts. You don't have to tuck in your shirts. You don't have to get on the floor. You can just,
right.
You just sit there.
Relaxed.
Awesome. All right. Well, Lisa, why don't you walk me through kind of what was going on in your life before we started working together? You know, any symptoms, how were you feeling, and what brought you to joining the program, and what interested you in that?
I have had issues with one of my feet, or maybe both of my feet, my whole life, on and off. Had plantar fasciitis several times, metatarsalgia, I don't even know if that's the correct term. Just Achilles tendonitis, all kinds of stuff going on. And I have tried everything over the years. And as a PT assistant, I thought I knew everything there was to know about what to do. And turns out that was not true. So just before COVID hit, I was out on a 6-month medical leave for a thumb joint replacement. So I was home and I had plenty of time to walk. So instead of walking 2 or 3 times a week, I walked 5 and 6 days a week. Instantly flared up my foot and just had all kinds of major pain. Was limping around, dragging my foot like it didn't even belong to me.
Yeah.
And I did, I wasn't at work, but I knew all the things to do. Problem was, I had multiple issues going on in my foot. So one treatment is that exacerbated another symptom. So I didn't know what to do. So long story shorter, I ended up kind of resting, which I think was a really bad idea. Instead of, I iced, I used heat, I stretched, I did everything I could do, and nothing worked. I would still get up in the morning and I was limping and hobbling and dragging my foot around like it didn't even belong to me. And so imagine my surprise as a PT assistant. I know just enough to help you with whatever's going on, but I can't figure this out.
Yeah.
And so, oh God, super annoying. Yeah. So by the time I got back to work, I mean, I hadn't walked in months and I was depressed and I was in tears and I didn't know what to do. And the first thing one of my PTs said to me was, you need more support on your shoes, more supportive shoes. Well, I had finally got to the point where I was in barefoot shoes, minimal shoes, and I loved that. And my muscles in my feet were doing the work that they were supposed to do, as I know is important. Wasn't enough. So I went back to the really cushioned, supportive shoes for a while just to give things a break. And I started, heel dropping off, standing calf stretching with my heels dropped off the back of the step. Mm-hmm. That wasn't really doing anything. And I really didn't know what to do. And when I saw you in an interview because look, I was home for 6 months. I did the deep dive, man. I did.
You were all researching.
I was all over the place.
Yeah.
My husband would say, are you going to get up and move or get dressed today? No, I'm going to figure this out.
It's really interesting how much you were researching about movement, though.
Well, we're sitting on our butt.
Mm-hmm, yeah.
I know. I was there. And so I just knew I could figure it out. Well, a couple of sites were really cool. And they showed me that, your muscles in the bottom of your feet need to be strong. And you need to be aligned in your posture. And you need to have everything working together. Well, What did that mean to me? I don't know. I'm just going for the symptom. It hurts. I'm going to roll it on the ball. I'm going to ice it. I'm going to do all the I'm going to do all the stuff that I know to do, but that wasn't enough. And then I started realizing, okay, one foot's tipped outward and another, my hip hurts and my back hurts and my shoulder hurts. Oh my God.
It's all connected. Yeah.
Well, I had looked into Egoscue years ago, and I have all the books and I have done his exercises for years, but I didn't know where to go with that. Okay, so I did all that and I didn't know where to take it. I kind of reached the limit of what I knew to do, and what exercise do I do now and what should I do? I don't know. Yeah. So, and I saw you on an interview through somewhere, the deep dive of Egoscue.
Yeah.
Rachel Merrick, because I'm always looking for, that was what it was. They only have the clinics in Kirkland and Renton or somewhere up north. I thought, I'm not going there once a week from Tacoma. That didn't seem realistic to me. But there you were.
There I was.
Showed up, and I thought, okay, this is kismet, man. This is supposed to happen.
And it was cool because we actually haven't actually met in real life. We've just done it all online, which has been pretty cool.
Because do you remember my first email was, I would like to do this in person.
Yeah.
I've done this in person. I had never done this Zoom thing. And I thought, I really would rather do a one-on-one in person. Well, that wasn't available. So, okay, we can do this. It's been amazing. It's been simple. It's been, you're so good at instructing. Tip me down, tip me down, tip me up. No, I don't want to see the door. I need to see you.
I'm really glad you mentioned that, because I still get, I only do online. I only do Zoom. I do no in person. And I get people wanting just to have in person. And it's a little sad because it does stop them from getting help and getting treatment. They're like, oh, I can't do it in person. I'm just not going to do it at all. But like you said, there's might be a little bit of a reservation at the beginning, like, I don't know how that's going to work. I'm not necessarily tech savvy. And the first day, it's a little nervous, it's like, okay, how do I turn on my microphone, whatever. But it's super easy to use. I mean, I know I've had a couple people like that where I end up just like calling them and walking them through it while we're trying to get on the Zoom. But as you get used to it, it works really, really well. And the nice thing too is you're setting yourself up how to do the exercises within your own environment, right? So you're not having to go from a clinical setting where, you have all of the tools or the right things, whatever that might be, and then transfer it to your home. It's like we're setting you up exactly where you're going to be doing the exercises within your home, because you have to do the exercises in between.
Right. And we're modifying everything with what I have here.
Exactly.
I mean, I remember early on we were moving you around, and I had this shelf that I put you on, and it was like, and you were in the window in the summer.
Yeah, and the air conditioner. I remember that.
But then the air conditioner went in, and now I can't put you there. And now what do I do? It's been pretty seamless, I have to say.
Yeah,
it's been pretty easy, but.
I want to just go back a little bit to what you were talking about, was how, you were walking for a lot of time, like 6 months you were on leave, you were walking a ton, you were getting that movement in, but your alignment and your posture alignment was out of whack, that walking was creating more symptoms. I want to bring this up because I'm a big advocate of movement. I'm a big advocate of walking. I talk about this in my free Facebook group all the time, the posture and pain community. I talk about how can you add movement through your life. But sometimes if we're in a compromised postural alignment position, walking can potentially or not just walking, movement can potentially exacerbate symptoms. And that's where we really need that intervention of the proper postural exercise stimulus to change your alignment. And then your movement gets to be seamless, right? So sometimes, depending on the person, just moving more really helps, but sometimes depending on the person,
it makes it worse.
That can make it worse, you know. And then they go into, like you go into this, like, I can't move. Anytime I like move or do anything, it's going to make things worse. And then it's really easy to go, just really easy to limit everything. But that's super duper frustrating because your life is now limited, especially if you can't walk, you know, without pain. Like, obviously you still walk, but like,
you have to do, but
you have to, right? But changing then the postural alignment first, then easing into the movement, it makes it more seamless, right? We don't just force you back into movement. I didn't go, well, Lisa, sorry, just keep moving because that's better for your body. It's like, no, why is the movement hurting? And let's change that first, and then you can seamlessly go back into movement, right?
So you early on, you know, my least favorite part of this whole thing, of course, was the pictures, because I
be honest, yeah, the pictures, yeah.
I've got sleeveless shirt on because you need to see my shoulders, and I've got my shirt tucked in because you need to see my hips, and it's like, that is the last thing I want to look at, is that.
Everybody hates the posture photos. Everybody hates them. Yep.
But it was very insightful, because even recently I was looking at them and going, oh, my left shoulder does still drop and it still isn't corrected. That's okay. I have time. I know what to do to work on it. But when I was walking all the time, when I could, because I finally had the time, I didn't realize, I thought if I just focused on walking with my right foot kind of wings out a little bit. Yep, and I thought that was kind of the only problem. Really, as a PT assistant, I know just enough to be really dangerous sometimes.
That's what my mom says all the time. And as somebody dealing with pain, our immediate reaction is our attention goes to where the symptom is.
Yeah.
Right. Exactly. And you and I talked about this at the very beginning, and I commended you at the very beginning for reaching out for help, because sometimes, you know, being a PT assistant, personally being a posture alignment specialist, sometimes we can be like, oh, I should know all of this. I shouldn't need to reach out for help. You know, I do this all the time because I need other people to give me my posture sequences too. Because if something is kind of aggravating me, my mind is going to go to the area that feels uncomfortable.
Right.
You know,
the area that's the problem.
That's it, but it's not the area that's the problem. Like you had mentioned, you were doing a ton of foot exercises. When I talked to you, you were doing the Agastu foot exercises, and
it wasn't helping.
And it wasn't helping, right? Yeah, but because it's all connected. And then we had you do, I remember on the phone, and I talked to you, we had you do this hands behind the head, pull your elbows back, walk like that.
And it quit hurting.
Your foot quit hurting, which was pretty amazing. And for anybody, you know, that watches this, just try that. If you have foot symptoms, put your hands behind your head, pull your elbows back, walk like that, and notice if it changes. And why is that? Because your body is all connected, right? Changing your shoulder alignment actually changes how you have balance in your feet, right? And so I think that was a really big aha moment at the very beginning, right? Where I actually had you stop doing all of the foot exercises and
that
really
scared me.
Yeah, I know.
You were like, right? Because I thought, oh God, are you kidding me? And I tell my patients now, look, this is connected to your big toe.
Mm-hmm. Yeah,
but
exactly.
If you have a wonky shoulder, do you think that all those muscles that are linked all the way down, do you think that's not going to affect you? Because let me just tell you, it will. And
it will.
It's amazing how my thought process has completely changed. And I've also, even though I'm not 100% the way I want to be, I am so close to there. Things hurt less. Even if they do hurt, the intensity is less. I'm not hobbling around in the morning. I'm wearing no shoes probably 4 days a week at home, and I'm good. I'm not hobbling around anymore like there's a rock in my shoe, but it's amazing how you don't know
what you don't know.
Well, you don't know what you're doing when you think where you need supportive shoes and you need to have arch support. Well, guess what? Arch support is what it's doing is it's supporting your foot the way your muscles should.
Exactly.
But if your muscles aren't able to support your arch, the rest of your body's going to be all messed up. And people don't get that. I got these really great Skechers cushy shoe. I shouldn't name that brand, but cushy shoes, and I've got all these arch supports, and I've got all this stuff. And I said, what do you think what happens when you walk barefoot? And they go, oh, I can't walk barefoot. No, because your muscles haven't got a clue. They're not able to hold you up. But these are all things that I've learned over the years that, as for me, I want to walk barefoot. I don't want to wear shoes if I don't have to. Mm-hmm. If I wear shoes, I finally this week, just FYI, I got back into my barefoot shoes, my no support shoes, and I didn't hurt at all.
I love it. Love it. Well, and that, a lot of people think when they want to transition to barefoot shoes, this could be a whole nother talk actually, but when you want to transition to barefoot shoes, a lot of people think that, you just need to focus on strengthening the muscles in your feet, strengthening the muscles in your lower leg, basically the below area, right? But like we just talked about with your arms behind your head, changing your shoulder position, changing your spine and your pelvis alignment, it's going to make a huge difference. And it's actually going to make that transition a lot more seamless without even having to work on strengthening your feet per se. Once you then transition into the barefoot shoes, your natural walk is going to help strengthen and mobilize your feet when everything else is working properly, right? Yeah, because you're not the only person. I had one woman who she would never go around her house barefoot. She didn't have foot symptoms unless she went around her house barefoot, and she would start to get a hot spot. And I was like, well, I'm not going to force you to go around your house barefoot. None of this is about forcing you to be uncomfortable. Right? I was like, okay, let's work on your alignment, work on your posture, just bring everything back to balance. And then gradually she just didn't want to wear the shoes as often, and now she's transitioned into complete barefoot shoes. Like anytime she does anything, which is pretty cool.
The thing is that people don't realize, I thought as a PT assistant, I know quite a bit. I've done this for many years, and I felt confident that I could take care of this. But what I wasn't doing is changing my posture. I wasn't changing anything from head to toe in my alignment. And so what ended up happening was I started doing the Egoscue exercises that I knew for my feet. They were no longer working. And then I started, I'm doing this maintenance exercise routine, and the symptoms were changing, but they weren't really getting better. And I didn't know where to go from there. I mean, I thought, I hadn't even stretched my calves. I mean, I really just focused on foot strength and rolling my foot over a ball and toe curls and, things that I thought would help. But when I saw you and you had me walk with my arms, I thought, are you kidding me?
This girl's crazy.
but it was crazy how much I didn't know about posture, because that's not where I specialize, which is where you come in. And so when we started doing things that really addressed my lack of mobility on one side of me that affected the other side, I was stunned. I mean, stunned. I thought, are you kidding me? I can't bend this way. So now this foot hurts, and you sure as heck.
Yeah. Oh. Well, and it was really cool too, because since we're not focused on the symptom, right? Since we're not doing exercises for your foot to help your foot, other things were changing too. I remember the first things that changed wasn't necessarily the foot, because that was the big symptom.
Yeah, that didn't change for quite a while.
Exactly, because we're working through, years of dysfunctional movement patterns, of walking incorrectly, and not your fault. That's just how it is. You know, but other things were changing. Like you're like, oh, my back isn't as tight. Oh, my hip can rotate better. Oh, like every time I talk to you, you're just like, oh, this feels a little different and it's better. And it was gradual. It wasn't just like a, you know, oh, magic pill, but you know, a lot of things that are worth it aren't magic pills.
No, they're not. That's my toughest lesson for my patients is, look, I don't have the fairy dust and I don't have the magic pill. And I don't have anything that's going to go poof. Now you're better. You got to work for it.
Yeah, you got to put it in your work.
The fact that it wasn't quick tells me that it's more worth it because I'm working toward changing my body. I'm not asking for a quick fix. What I'm asking for is to spend the next 30 or 40 years hiking and walking and doing things that I like to do without hurting, without dragging my foot like it doesn't belong to me.
Yeah.
And that's what's already happening. I mean, I've already been able to walk. I think I went to the coast a couple of weeks ago, and I was able to, for the first time in more than a year, I think, walk on the beach in the sand. And it was amazing because prior to that, my foot was bothering me so much that I just sat on a log at the top of the dunes looking at the ocean, and I wanted to be on the beach. And I couldn't do it because when I did the one time before, it really messed me up. So the little things like that I don't think about anymore, that I can walk for an hour and not think about it. And even if at the end of the day, that end of that walk, I'm a little bit sore, it's okay because I know what to do. I just put it on my foot massager, or I stretch, I do my exercises.
Exactly. Yeah, I talk about that all the time is, you know, part of having a pain-free life isn't that you just never feel anything wrong, right? If I sit at my desk for 8 hours today, which I actually have a long day today, so I'm going to be sitting on here, I'm going to get up and I'll be like, oh, okay, I feel a little off. Oh, I sat on my butt for, 8 hours straight, didn't have a lot of movement breaks because that's what our bodies aren't made to do, But the game changer is having the knowledge for your own body to, one, not be scared of anything if it happens. Like you said, you can maybe go on a really, really long walk and you come back and you're not scared that your foot is going to put you out of commission for the next 3 days. Right. You're like, okay, it's sore. I have confidence that it's going to go away in a little bit. Let me just hit my exercises a little bit hard. Let me just take care of myself a little bit better, or a little bit more that night. Not that you weren't doing not better, more. And then the next day it's like, all right, we're good to go again, and that's part of life. And I think sometimes people don't necessarily understand that, they start to feel less pain. Maybe their pain even goes away. And then if something pops up again, it's like the world ends, right? Where it's all over. Nothing is ever going to work for me. Nothing is. But that's part of the healing journey. And I think what sets this process apart is the empowerment and the knowledge for you now to take what you've learned and utilize that going forward. And so your healing process continues, right? Even if we're not working one-on-one together as often or at all.
What to do, where to go, and what do I feel like? I mean, you've asked me on a regular basis during our meetings, what do you feel like you need to do now? And there are times when we've done a lot of trunk rotation exercises where I felt like we needed to do dog cat.
Right. Yeah.
And so that was really helpful because then I started thinking about, okay, well, I've been doing all this twisting stuff and now I need to arch, I need to do something else. And back to your comment about things aren't always going to be, you're not always going to feel great. The thing I learned is there are times when I've gone on a long walk, or I've hiked in Point Defiance, which I love, or somewhere on the beach, and I hurt, and oh my God, my feet hurt. And I look at my handy dandy that I can't read anymore. My new little watch that's too small. I think, oh, well, no wonder I'm hurting. That's a lot of steps for me. And I knew what to do.
You knew what to do, yeah.
I do some foot ankle exercises. I do some posture. I do some bending. I do something.
Yeah.
Anything. And there are always going to be days when we're sitting on our butt, because guess what? Life happens. But
life happens.
Get up and move and stretch and do what your body feels like. You helped me learn what to do.
And I think I helped you trust that your body will heal too. Yeah. I think that's a big one, you know, and I talk about that with a lot of people. Is part of the process is learning how to trust yourself and trust your.
And that's hard.
It is hard. It is hard. But I really think watching people go through the 4-month program, I can see the transformation that a lot of them do have, because I'm not
see it. We don't see it.
You don't know. Because a lot of them do have so much more trust for themselves afterwards. Maybe they don't even realize how much they didn't necessarily trust themselves before, or trust what they're feeling, because we're really taught like not to necessarily trust our own feelings, you know, rely on other people to fix us and not ask the questions to ourselves on how to fix ourselves, right? And I think that's what sets this process apart a little bit, because, you know, 4 months is the beginning of the process.
It's true. I never thought, I kind of, for a little tiny minute, I thought 4 months, I should be really good by then. No, not so much, because I've spent years and years and years.
Yeah.
Building up to the way I am walking and I'm moving and I'm making corrections and.
But even then, you know, everything's not perfect, but a lot has changed.
A lot has changed. A lot.
Right?
Well, so much so that I feel like there's nothing I can't do right now. Even in this short 4 months, I feel like I could go for an hour or 2 walk and it's not going to kill me. Even if I did that too many times and I came home and my foot was killing me, or both my feet are pretty tired after that, I know what to do. It's okay. I do some mobility work. Maybe I put my foot on some heat or whatever I do. It is just fine. And the next day I'm no worse than I was before. And that is the amazing thing. That's the thing that I love, because even when I get up in the morning and you know, typical plantar fasciitis stuff, you get up and you're hobbling along and, oh my God, I can't move. And it's even better in the morning. It's even less intense. So things are changing and they're just going to continue to get better.
That's going to continue.
I know what to do now.
Exactly. And that's the thing, is now you have all the knowledge. And you know, sometimes when I tell people it's just 4 months, I like to be really upfront with that expectation. It's like, it's not that all your pain's going to go away in 4 months, because like, this isn't a magic pill. This is hard work. This is working through years of, you know, moving. I hate using the word poorly, but moving poorly, you know, moving incorrectly, right? And that's not all going to change in 4 months, but a lot can change in 4 months, and your symptoms do go down. Maybe it's not perfect at the end of the 4 months, but it continues to grow because you now have more knowledge about what you need to do to continue that growth process, instead of having to rely on, you know, outside sources or outside healing modalities, you know.
Which I have patients who, I go to massage, I go to chiropractic, I go to PT, I go to all these things, and I say, well, how are you going to know what's working if you're doing all of this stuff? How are you going to know it's working? How about if you just try exercise and realigning the way you're set up, the way you're sitting, the way you're walking, how about if you work on that and see if we can change you from now on? I mean, not just temporarily adding some stretches and exercises, how about if we realign you so that you're working at your top mobility? I mean, and then we'll know what's working. But if you're going to continue to do all this other stuff, it can be really beneficial, but it's really just covering up. It's just a temporary feed. It's not helping. Long-term. Chiropractic, there's a place for them, certainly, but they adjust you. And now what are you going to do to support that?
Exactly.
Something to support that and to adjust your posture and your body to support that. Massage, that's great. You go get a massage and you feel all good and fine, but now what are you going to do to support that?
Yeah. What do we want to take responsibility for our own bodies, and exactly how can we support these other modalities and take it to the next level, right? Because if you're doing the work that to support it in between your sessions of any sort of body work, your sessions for your body work is going to go to the next level because you've supported it instead of taking one step forward, one step back, one step forward, one step back, right? You're continuing the work on your own. Then you go and get a body work, whatever that might look like for you. And it's just like, takes you further.
Well, right? And I think a lot of people, I really wish this was different, but I think a lot of people are intrinsically lazy and they want the fairy dust and they want the pill and they don't want to do the work. But as they can learn how important the work is, right? And it doesn't have to be a lot of stuff. I mean, since I started working with you, Rachel, I get up 30 to maybe 40 minutes early, depending on how mean you are. No.
Wow. Okay.
How much you add to my morning routine? Because I said, look, if you give it to me, I'll do it.
Right.
And I am cool with that. Because the bottom line is I want to feel good for the rest of my life. I want to work 30 or 40 years. So anyway, when I do the work and I get up and I set myself up. So let's say I do 35 minutes of posture exercises in the morning. My whole day is better because I'm moving better. I'm moving where I've set myself up and I'm in the proper position and I'm doing what I should do. So by the end of the day, I'm not as tired. My feet don't hurt as much. There's no problem. The days that I don't do it, because there have been a couple of days where we had some losses in our family recently in the war where we've had days where we really had no time to do anything, but
life happened.
Family life happened. Yeah. So on those days, oh boy, did I notice the difference. I mean, it could be as simple as 20 minutes in the morning. It's not that hard.
It's not that hard.
It's get out of bed.
It makes a big difference throughout your day. And I think that's where, some people have gone through experiences before where they're trying to do something like this and they don't necessarily feel a difference, right? Or they haven't tuned into their body enough to like kind of feel what's out of whack and feel how it got better, or their education process comes into that too, and sharing why we're doing what we're doing, not just blindly giving you, okay, do this exercise, this stretch, this exercise, and just follow that, right? The process is, okay, what do you feel here? And some people aren't necessarily like super in tune with that. And we work on that, it doesn't necessarily happen overnight. But getting more in tune with what you're feeling and then how you bring it back to better alignment and those changes, then you can feel the difference throughout the day. And part of that is a little bit innate, but a lot of that is taught through the process. Right. And then you can feel that difference versus blindly doing an exercise and be like, okay, I think this is good for me. Let me just try it. But not really knowing why you're doing it or what it's helping you with.
Well, and that's a big deal also with how I practice. I am not that person who's just going to say, do these stretches. Here's your exercises. You have for back pain and do these things and you'll be. I want to tell you why you're doing it. Yeah. Because for me, if you tell me to do something and you don't tell me why I'm doing it,
I'm not going to do it.
I'm not going to be as motivated to do it because I don't know what it's doing for me. So, you have to teach people what they need and why they're doing it.
Yeah, but in a fun way, in bit-sized chunks where it's not like, overwhelming. And I know I've talked to some people at the very beginning of the program, it can be a little bit overwhelming, just all the things that we're teaching. But then you take it a step back and be like, okay, well, you don't need to worry about that. Let me just give you, like, spoon feed you the information of the things you need to worry about. You don't need to know all the fancy names of the muscles. You don't need to know all of that. But you do need to know how to feel and trust that feeling. It goes back to that trust that we were talking about beforehand. And you're exactly right. I think that empowers people to continue the process instead of, just doing an exercise and not knowing why you're doing it.
And you're very in line with how I treat my patients. Because if you don't understand why we're doing this, you're not likely to care and put importance on it as to why you should be doing this. And every piece plays on another. So we'll start out doing a few exercises and how do you feel and are you improving from visit to visit? And then you come in and then we adjust it and we modify it. And that's always what you're doing too, is you're always modifying. I mean, every time I see you, you're taking pictures and you're testing me on exercises and you're seeing how it's changed my posture or not. And there have been times when you've said, yeah, that didn't really do anything. Let's try something else. You try something else. Oh yeah, that noticeably made a difference. And so those are the things that I want to do with my patients too. And that's what I do. How do you feel after you do it? Because you have to be specific with people. Mm-hmm. They're not going to do a handful of exercises and go, well, I don't feel any different after. Well, how do you feel after you did this as opposed to that? I mean, you really have to get in and dig.
Mm-hmm. You have to tune in beforehand of trying to figure out how you feel off versus then how you feel on, and I think oftentimes we're not doing that comparison. So you brought up, working with your patients. So can you speak a little bit to kind of the different processes of going through this process and then the traditional physical therapy process? Because I know people hearing this, and a little bit, it's hard to describe because you and I have talked about this very, very, very often before. It's very different. Yeah, I get that question a lot. How is this different than physical therapy? And it's like, it's very different. But it's very hard to describe how it's different. So, I mean, you don't have to have it perfect, but can you just speak to that a little bit? Yes. I know it's hard.
It has really made me really do the deep dive into how I'm treating my patients. Mm-hmm. And so as a PT assistant, I have physical therapists that I work under, and they sign off on my notes and they lead the exercise routine, and I am free to change things up. But since learning all this information, I have been really confused as to what am I going to do now? Oh God, how am I going to change this? Because I no longer feel like some of the standard exercises I'm doing for my foot patients or my back patients or anything are enough. Mm-hmm. And so I'm kind of at a turning point where I'm not sure what this is going to look like in the future, but for now, I am certainly making adjustments in people's programs, exercise programs, for things that I feel like, okay, look, I'm just not going to lie to you. A 15-minute stretch is not going to be enough. Right. You're going to need to do more. You're going to need to do a minute or two or maybe more. And I'm slowly I'm incorporating this into my PT program where it's not at all going off the grid and going rogue.
Right. Yeah.
I like to, but I'm not gonna. But but it's just basically incorporating some of the things that you've taught me with, you need to do these longer than we think.
Okay.
So a calf stretch, 30-second calf stretch, not enough. Yeah. I'm doing 2 or 3 minutes, and you're going to feel it. And your muscles are going to make changes that are going to support your whole body. So it's been really challenging, and I'm not even sure, I'm certain I'm not done learning what I'm going to do in the future. And I'm probably going to need you more.
You can reach out. Do you find that it makes a big difference? So for people who don't know, like I went through a lot of physical therapy for a knee injury years ago, and that's kind of what started me on my process as well. And I was at the physical therapy office for 7 months, 2 to 3 times a week mostly, and I loved my physical therapist. We had great banter, like we talked all the time. But there was a big difference in what this process is to what I was doing. And I think one of the biggest differences is the awareness of where the rest of your body is when you're doing an exercise that's focused on a specific area. So what I mean by that is, like, you know, if you're doing shoulder exercise, if you're working on a rotator cuff or something like that, in this process, your feet are going to be straight. They're going to be hip width apart. They're going to be like, everything below your shoulder is going to be lined up. And I think, and granted, I'm not knocking anybody else, but I don't think the traditional method of physical therapy is necessarily focused on the position of everything else when you're working a certain area of the body. And I really think that's what sets this kind of apart.
It does. And that is also deeply incorporated into my current practice, because I never really looked at that before. Until
a lot of people don't.
Yeah. I never really thought about, where are my feet in relation to my shoulders? If I'm doing a doorway stretch and I'm in here, where are my feet? It never really mattered.
Yeah.
And now it does.
It matters completely.
Oh God. When people do stretches and their feet are, I mean, turned in
different angles and like, one's forward and one's,
and then they're arching their back and they're hunching over. It's crazy. I'm finding myself making detailed changes to their exercise program, where you need to look at this and
all the little things.
Your feet are just pointed inward just a little bit, you know, and you're not arching your back, and all those details that you have taught me, which I really never was diligent about before. Because basically, if I'm working on pec stretching, I'm in the doorway and I'm doing this. I don't want you hunching forward, but I never really thought
you're focused on your pecs. You're not focused on everything underneath it. And I think that, exactly.
And people say, you've got to put this all in my exercise thing, because I'm not going to remember this. I'm okay with that.
Yeah, exactly. Well, and I've accepted with any of my clients that I'm just going to be obnoxious about it. And people have told me, because throughout the session, I'm just like, where are your feet? Like, where are your hips? Where are your arms? And, you know, I do it specifically to be like, to say overly the amount. It's like, roll your pelvis forward, like 5 seconds, roll your pelvis forward. And then when you're on your own, that you're hearing that voice. You hear, oh, Rachel, feet, you know, and and
that's what my patients always tell me too, is I hear your voice. Well, thank you.
Good.
You need to hear my voice, because the thing that I'm always surprised about is how many people don't read the instructions of the exercises. Come on. I have your programs printed out. I read every bullet. Yeah. I need to know I'm doing it right, because once you learn something, if you learn it incorrectly, it's going to be a lot harder to change.
It. Yeah. And I think the longer you go through the process, you know, it can be very overwhelming at the very beginning of, you know, you're doing a shoulder exercise. We're doing like arm circles or elbow curls. These are pretty common ones that you see on my social media and stuff. at the very beginning, I'm like, okay, where are your feet? Where are your ankles in relation of your knees? Okay, roll your pelvis forward. And it's very overwhelming. It's like, okay, I have a checklist of like 5 to 10 things to think about before I even get to actually doing the movement. But through a couple, even just like a week to 2 weeks of that, people are already starting to kind of be able to go through that checklist. It just takes somebody to, be that stickler about it and push that checklist so often of pay attention to your feet. This is something I notice. I'll go to like a community yoga class sometimes, and I'll see people with their feet kind of turned out or in different positions and stuff. I'm like, just changing your foot position to being perfectly straight makes a game changer of the rest of your body, and you're already bringing slightly more balanced positions into your workout. So, I mean, if you get nothing out of this video, which you're going to get a lot of things out of this video, is pay attention to your feet when you're doing exercises specifically.
The other thing is, Rachel, that people don't, and prior to meeting with you, I didn't do this either. I had no idea that my foot position was based on the outside, my pinky lineup.
Yeah.
I had no idea.
Yeah.
When you said that, I just thought, holy crap, are you kidding me? Here I am thinking I'm straight because the inside of my foot is straight. That is not straight at all.
Yeah, this is straight. It goes from the outside. It goes from the pinky toe. So the pinky toe has to be straight versus the inside.
That changed everything. I just thought, okay, a lot of people don't know that. And I think that's a really huge, big deal, because it sets you up for, if you're standing weight bearing and doing any exercises, if you're doing it with your feet the way we think we should have it, no, you're not getting the most out of it, which is amazing. I couldn't believe it.
Exactly. And sometimes people will take that and then they'll try to walk like that, and you don't necessarily have to force that when you're walking, but the whole point is doing the postural exercises correctly with that position. Your body adjusts to it better, and you take a more balanced position to your movement. You don't necessarily have to be like, okay, my pinky side toes are looking up and everything is working perfectly, because like you're not gonna that's not gonna actually feel good, right? But we're training it so eventually it will. Right. But that comes with time, obviously.
I mean, all of this stuff comes with time. And just in the few months that I've worked with you, I cannot believe the changes in how I feel. And not just physically, but that comes down to mentally too, because honestly, before I met you, I was feeling pretty hopeless and pretty, how am I going to get through the next 30 years? I don't want to be one of my patients who waits until they can no longer move. I don't want to be that person. I want to be active and moving and hiking and kayaking and canoeing and doing all the things we like to do.
Ooh, especially living in the Pacific Northwest, there's so much to do outside.
Exactly. Yeah, it's amazing. And we have a cabin that's on the water, and we want to go play. And I don't want to be that person who says, sorry, my back hurts today, or my foot hurts. I'm not going to be that person.
Yeah.
But it's baby steps. It's not, you can't just say, I'm going to do a couple of stretches or a couple of exercises and I'm going to be okay. You've got to start from the foot up to the head. And that's where you come in. That's where you align us and make us accountable for what we're doing and not doing.
Yeah, keep your eye on the goal, right? I mean, I love that you mentioned that, because that is my goal for all of my clients is keep them doing what they want to do. And that was my goal personally when I was dealing with my own pain, as I looked forward to the future, and I was like, I'm not going to be able to do anything that I want to do. I was 22 when all this was happening too. I was like, no. And that was where my mindset went too, is finally I was like, enough is enough. I got to figure this out. I got to do a deep dive, because I was in a very, very similar situation to you. And I think a lot of people that work with me are in that situation. But and it's hard because, like you mentioned, there's that almost that hopelessness. It's not fully hopelessness because you do have hope because you're still working towards it. But also when you're at that point, you're gonna commit to making a change. You know, you're not gonna take it lightly. You're ready for the next step or to level it up. And so I think, good for you. Good for you.
But the other thing is, I mean, I never thought I'd be in a position where I would have to even think about how I'm moving and how I'm walking and how I'm sitting and how much I'm sitting and all those things that I never thought about. And I'm 60 years old and I'm thinking, oh my God, I am not gonna, with any power I have, I'm gonna live to be 90 or 100. And
love it.
I damn sure better be walking and hiking and doing all these things. So
love it.
If you don't start now, when are you gonna start?
Yeah.
When are you gonna start? I mean, are you gonna start when you're 20 or 30 or 40? When are you gonna start? When are you ready to live the rest of your life in feeling good and your body is aligned the way it's supposed to be and you're walking the way you're supposed to be and not all these funky little crazy what's the word things that you've created for yourself, dysfunctions, these dysfunctions that you've created for yourself. When are you gonna be who you're supposed to be? I mean, that's what I want for myself and my friends. I want to be who I'm supposed to be, and I want to feel good doing it, and I want to go out and do things.
Oh my gosh. On that note, I think that's a great place to end today. Thank you so much for coming on. It was such a pleasure chatting with you and working with you for the past 4 months. Thank
you. I loved it.
It's been so awesome. All right, Lisa, thank you so much.